come home or when they come to the ministry, they indicate that they have agreed on this particular route. I just want a little clarity in this, because if that is my interpretation, and that to me is the wrong way of doing things.
Well, as a experienced policymaker, legislator, I think you will appreciate that it works the other way. So policy guides the technical people. I mean, they provide advice. Ultimately, policy is taken or advocated by us, and the follow through takes place. So these discussions would have to benefit from some mandate and guidance that is given to them prior to taking place. So
and if I may agree with you, Minister, that ought to be the case, but in terms of how this is presented here, it gives a different impression.
Minister, if I may.
Yes, Ms. Dennis, you want to come in?
Right. So I would like to provide clarification, and I read it too, and I understand that based on the way it was construed, it can possibly give another impression. Now, what I was indicating in relation to Article 5.3 is that the Framework Convention, the way the clauses in general are construed, would be construed in a way to give the impression that they are not obligatory. However, when parties generally sign the FCTC or other treaties, once they have incorporated it into domestic law, then it becomes binding. However, when we sign, well, the fact that we have ratified, it means that we have signaled an intention to comply. As it relates to Article 5.3, however, when the parties meet at the COP, at the Conference of the Parties, they would speak on specific provisions, and then there is a decision that is made at the end of the COP or at the end of the session where those provisions are dealt with. And the decision coming out of the COP, based on those discussions and based on the parties, or a majority of the parties that have signaled their commitment to it, is that as far as possible, countries ought to comply and ought to put in place provisions that are in keeping with Article 5.3. So it was not to give an impression that...
I mean, for clarity purposes, since we're dealing with the minutes, and we're being minuted now, we may just want to just be clear, and so that member Guy or anybody else for that matter is not under any other notion. So you want to just state it clearly for the minutes, please.
Right, yes. So it's not that we went to the COP and we gave we gave any signal that was contrary to Jamaica's position. Whatever the parties as a majority decide, then parties would have signaled their intent to become bound, and it would generally stand as precedent for the entire COP or for all the parties.
Thank you.
We have not given any contrary intention at these meetings.
Thank you, Ms. Dennis. I think that clarifies. Member Guy, you're comfortable now?
I'm somewhat comforted, Chairman.
Somewhat. We don't like the somewhat, but
comforted, not comfortable, no, comforted.
Comforted. Okay. Okay.
Chairman, I gather there was an issue that required my...
Yes, Madam AG, we know you're very busy, but and we saw you clear and present online, but I know you stepped away. You were
yes.
Mr. Edwards, you want to just restate what the concern was?
Yes. Thank you, Chair. Morning, Madam AG. Morning. It was on page 2 of the minutes. It under the heading matters arising from the minutes, number 7, the second paragraph, last line, which referred to your having said, AG, she mentioned that different corporations may target children at lower ages for particular reasons. So we were just seeking to clarify that that accurately represented what you had said, AG.
Please excuse a clock that is this is in relation to the response that came from the Ministry of Education requesting their contribution to the bill?
No, this was in the context of the question of the age, the age group, the scope of age that child would contemplate. and we were explaining, and you had indicated, AG, that the Child Care and Protection Act now provided for a comprehensive 18-year threshold for children. And then this statement says that you mentioned that different corporations may target children at lower ages. I'm wondering if it's the word corporations or different legislation. The word corporation doesn't seem
No,
to
that
fit.
doesn't seem right at all. Right. Let me just check it. I will revert. I'm just looking at it.
Okay, thank you.
May I ask that that aspect be deferred and be recommitted in short order?
Thank you, Madam AG. Okay, so if there are no other matters, I would like us to go back to the substantial item on the agenda, which is the presentation, starting with the National Council on Drug Abuse. Mr. Tucker, welcome. You want to introduce any other member of your team, upload your slides and proceed. We are recommending a 15 minutes presentation, give or take a minute or two, and then a discussion. And I'm inviting members to jot down their questions or comments, and we will take them in order of the hands raised after. Mr. Tucker, over to you, sir.
Yes, morning, Minister, morning, distinguished members of the committee. Thank you for giving us the opportunity to present this morning. With me here are Ms. Colette Curlew, the Director of Client Services, and Mrs. Uki Atkinson, who's our research analyst. So they'll be here to answer any additional questions that you may have.
We're not seeing the presentation in its fullness. Can you, is it that your screen is it's small? You need to maximize the full presentation screen.
Need to change the mode.
1 minute, Minister. We're doing that now.
What I'm told. It'll need to be expanded a little more, Mr. Tucker.
Working on that now, Minister. We're going to maximize.
Minister, is it at all possible for the members of the team, if we could just see their faces for a moment, I could just get a chance to identify who on the team from National Council on Drug Abuse?
Okay, they would have to suspend the attempts at the putting up the screen.
Oh, no.
Yes.
When they start back, we could do that.
Colette Curlew.
Oh, there
Yes.
they are. There they are.
And okay, Atkinson.
Okay,
Good morning.
Morning.
All right. I think we've got that. How are you, ladies and gentlemen? All right, so let's try and get that screen sorted out. Still having issues, Mr. Tucker? Mr. Tucker? We seem to be having some issues there. Mr. Tucker?
Chairman, might I suggest, in light of the fact that we have the Heart Foundation here, in the interest of time, we could ask them if they're ready.
Let's say great mind things alike, but it's also fool seldom differ. So let's hope it's the former member guy. I was just about to suggest that while they are, is the Heart Foundation ready to present?
Yes, Minister. Yes, Minister, we are ready.
Yes, Jen. Why don't you introduce your team then, and I see you loud and clear. Who else is with you?
Yes, so I have Mrs. Barbara Magar, Project Manager, and Mrs. K. Morris Cook, who is our Communication Officer. Dr. Agri Irons, one of our board members, hopefully will be able to join us soon.
Are they in the room with you, or can they do the same?
No, they're in Zoom land, yes.
Can they show their face for a little bit? In keeping with the request by
there.
Member Allen.
Good morning, Barbara McGaw from the Heart Foundation.
Hi, Barbara. How are you? And who else?
K. Morris Cook.
Okay, where's that person?
Yeah.
Not able to come on, no? All right, so Mrs. Chen, you want to just put your slides up and proceed, please?
Okay.
Thank you and welcome.
Can you all hear me?
Minimize.
advertising of potentially dangerous products, even as the products remain on the market, such as firearms and fireworks. There's also another very important point. Tobacco use is not just a health issue. It's not just for the Ministry of Health. There are several other ministries that are involved in trying to prevent this. Tobacco use is a national development issue. If we look at data from the Health and Lifestyle Survey, and using in this case education as an indicator of socioeconomic status, we will see, if we look at the bottom in the red, current use, if we focus on that for the time being, is 19.9% of those with primary or lower education, 14.3% in secondary, and 5.8% in post-secondary. Let us look at it done another way. This is also data from that study. Current use, lower socioeconomic status, 19.3%, middle, 15.1%.
Chair, if I could just interrupt. I am enjoying the presentation, but if I could just ask Ms. Chen if she could, I don't know if it's Dr. Chen or Ms. Chen. Ms. Chen, Mrs. Chen, if you could just slow down a little bit.
No problem.
Thank you.
I'm conscious of minister telling me 15 minutes, you know.
I know, but it's a lot to digest. I don't think the chair is going to kick you out, so I beg you, just a little bit.
That's fine by me then. Sure, I'll do that. Thanks. Right. So here I'm just showing another way of making the point about the socioeconomic status. So here, which mirrors the other slide, that basically the higher income bracket persons smoke less than those in the lower income bracket. So we have done this analysis. If you're addicted and you smoke 1 pack of cigarettes a day, it's going to cost you approximately $445,000 for the year. But the minimum wage is $364,000. It's more if you buy a single cigarette. Now, you know, in our setting, a lot of persons go, they're at the construction site, they go to the cart and they on one. That comes to much more than the figure that I have mentioned here. So how then is this going to help with our national development? If persons who are addicted in the lower socioeconomic group cannot buy food, cannot access health care, and cannot provide for themselves and their families, this tobacco control act before you will protect the health of each person in Jamaica by restricting the use of tobacco products and relevant products and exposure to tobacco smoke. It will also protect the health of our children by preventing their access to tobacco products or relevant products. There is a fundamental, irreconcilable, and inherent conflict between the tobacco industry's interests and public health policy interests. The tobacco industry, by their very nature, they're all about profit. They have an economic goal. Those of us in public health, our objective is to protect the health of the nation and to prevent premature death from tobacco use. Corporate social responsibility, this is very important. The huge profits generated by the sale of tobacco are sometimes used to promote the tobacco industry under the guise of being good corporate citizens. The tactic has been used globally, including across the Caribbean region, to boost the image of the tobacco companies. The tobacco industry relies heavily on CSR activities to normalize their products in light of criticisms aimed at advertising and promotional strategies and at the health impact of its product. This practice extends on occasion to involve government officials who may or may not be aware of their obligations under Article 5.3 or even of the inherent personal conflict of appearing to support and promote a product which causes such harm. Article 5.3, which you have heard a lot about already, speaks to industry interference and the commitments of the FCTC. It speaks to protecting tobacco control policies from commercial and other vested interests of the tobacco industry. The commitment is made recognizing the need to be alert to any efforts by the tobacco industry to undermine or subvert tobacco control efforts, and the need to have informed activities of the tobacco industry that will have a negative impact on tobacco control efforts. Part 3, what I will do is just give the Heart Foundation's opinion on some of these sections of the Act without actually reading what the sections are. Part 3, although they're listed on the slide, Part 3 speaks to the protection of tobacco control policies, which is again the same 5.3. 5.3 is a whole of government mandate, and prohibition should apply to all of government. These provisions are very important in terms of tobacco industry interference in tobacco control policy. The Heart Foundation fully endorses those provisions. The FCTC 5.3 has some guiding principles that cover this conflict of interest. We have already done principle 1, irreconcilable conflict. Principle 2, when dealing with the tobacco industry or those working to further its interests, these dealings should be accountable and transparent. Parties should require the tobacco industry and those working to further its interests to operate and act in a manner that's accountable and transparent. And because its products are lethal, and that has been proven, the tobacco industry should not be granted incentives to establish or run their businesses. There's also some key recommendations, and I'll only highlight a few. Parties should not interact with the tobacco industry only when and to the extent it's strictly necessary to enable
Sorry,
them.
may I just interject in respect of that point about operators not to be given incentives for business? Are you saying that it would be contrary to public health policy for the government to incentivize the business of tobacco where there is so much danger to health and in light of the government's own obligations?
Yeah, I'm having difficulty hearing.
Not hearing you, Madam AG. Your mic is going in and out.
All right, let me see if I can correct that. Hold. I'll come back to it because it's an important point in respect of public policy matters and how what government does against that backdrop.
Okay.
Yes, the FCTC, this is a principle of the FCTC, which is in, I would imagine, is included in the legislation and which the Heart Foundation endorses.
Okay, go ahead. Continue, Ms. Chen.
All right, so parties should, and again, these points I'm making here are from the FCTC. Parties should interact with the tobacco industry only when and to the extent that is strictly necessary to enable them to effectively regulate the tobacco industry and the products. Parties should not accept, support, or endorse any voluntary code of conduct or instrument drafted by the tobacco industry that is offered as a substitute for legally enforceable tobacco control measures. Parties should not award contracts for carrying out any work related to setting and implementing public health policies with respect to tobacco control to candidates or tenderers who have conflicts of interest with established tobacco control policies. Parties should require government officials to declare and divest themselves of direct interest in the tobacco industry. Parties should not allow any person employed by the tobacco industry or any entity working to further its interest to be a member of any government body, committee, or advisory group that sets or implements tobacco control or public health policy. Parties should not accept, support, or endorse tobacco industry organizing, promoting, participating, or performing youth, public education, or any initiatives that are directly or indirectly related to tobacco control. Moving on to the next section of the act that deals with tobacco smoke-free environment. As we had mentioned, there's no safe level of tobacco smoke, and even brief exposure can cause immediate effects on the cardiovascular system and other systems. The outdoor smoking solutions must be strictly enforced and in accordance with the provisions of the Act. The rights of smokers and non-smokers cannot be infringed upon. We support the distance of 5-meter radius from the entrance, exit, and window or ventilation intake, and the distance of 10 meters for outdoor smoking solutions. There should not be any enclosed smoking lounges. This section also speaks to relevant products, which includes e-cigarettes. Electronic cigarette and non-cigarette devices have been shown to be harmful to health, as we have just said. The Heart Foundation supports the inclusion of new and novel products under this section, including e-cigarettes. Part 7, Section 24 refers to the advertising, promotion, and sponsorship. We think that the recommendations included here are excellent in this fourth schedule. They should be adhered to rigorously, and the Heart Foundation supports a total ban on advertising, promotion, and sponsorship of tobacco products. The fourth schedule also lists forms of media and means of tobacco advertising, which, just to highlight a few: communication through audio visual means, provision of offer prizes or discounted products, free samples of tobacco products, including surveys and taste testing, incentive or promotions, payments or contribution to retailers to encourage or induce them to sell tobacco products, provision of financial or other support to events, activities, individuals or groups, such as sporting or arts events, individual organizations, politicians, and political candidates, or political parties, whether or not in exchange for attribution, acknowledgement, or publicity, including corporate social responsibility activities of any kind, and any other form of tobacco advertising, promotion, or sponsorship by any method or means, and we fully endorse those inclusions. In relation to Part 8, which speaks to reports and information, we support the need for regulation of tobacco product contents being made known. In terms of the penalties that are proposed, the Heart Foundation supports the fines and penalties that have been imposed under the bill, and this measure will be strong enough to encourage compliance. On to the matter of graphic health warnings. These are the pictures on the cigarette packages. These warnings have been shown to be a highly cost-effective means of health communication. Package warnings reach every smoker and the consumers of other tobacco products every day. Warnings are always working, 24 hours a day, 7 days a week. A pack-a-day smoker would take his or her pack out 20 times a day and over 7,000 times for the year. Warnings are also seen by those around the consumers, such as family, friends, and co-workers. These warnings are now placed on cigarette packs in many countries in the world, and 118 countries worldwide now have required picture warnings. 58% of the world's population is now covered by these warnings. And as of January, 19 countries had warnings that were 75% high off the packages. A recent study looked at the issue of warnings relative to size and found that size larger than 85% were more effective in increasing noticeability, warnings, and motivating cessation and preventing initiation. So that's a very important point for us. I would just like to stop here and recognize John Maxwell, who, this is a graphic health warning that's used on Jamaican cigarette packages, one of several. John Maxwell tried several times to start smoking and he just could not. He dedicated the last few years of his life to working with the Jamaica Coalition of Tobacco Control, which of we are a member, and the Secretariat, and gave us permission, legal permission, to continue to use his image along, and his family also supported this. So this is just, he could not stop smoking in the end. It caused his death, unfortunately. But we hope that his death will not have been in vain, and that organizations such as the Heart Foundation, the Jamaica Coalition, and members sitting here will help us to carry on his work. In relation to the continuing the graphic health warnings, we're full support of the increased size warnings to 80%. This is keeping with international trends and the provisions of the FCTC. I would just like to mention illicit trade in the context of Article 6 of the FCTC, which speaks to taxes. So that is the way in which I'm referring to this issue. Now, the tobacco industry has claimed that the sporadic increases in excise tax on cigarettes have resulted in a high level of illicit trade and subsequent loss in revenue to the government of Jamaica via these taxes. The Ministry of Finance and Public Service recently conducted a gap analysis technique in order to produce a transparent, objective, and plausible academic estimate of Jamaica's illicit trade. Specifically, the ministry imputed Jamaica's share of illicit cigarettes at roughly 8.7% of the total cigarette market in 2017, far less than the 24% asserted by the country's major tobacco industry in its 2018 annual report. The Ministry of Finance was able to successfully refute the industry's assertion of massive illicit trade of tobacco products in the Jamaican context. Jamaica's illicit trade, it stated, in cigarettes is mainly caused by a general border protection problem rather than tobacco excise tax. As we know, in the FCTC, it does call for taxes on cigarettes. There was a study done in 2015. Our last tax increase was in 2016. And the report said that the government of Jamaica is commended for implementing a uniform specific excise tax on cigarettes in line with international best practice. However, while the structure of the tax system is good, the government should adjust the nominal SCT on an annual basis to ensure that at a minimum, the SCT increases by the inflation rate. This has not yet been done. We would also like to suggest that some of the funds collected from these taxes or fines should go towards tobacco control prevention programs. So in closing, what are our key messages? The Heart Foundation is in full support of the Tobacco Control Act 2020. NCDs are the leading cause of death in Jamaica. NCDs burden health systems, reduce productivity, and can cause poverty. Tobacco use is a leading preventable risk factor for NCDs. There's a fundamental, irreconcilable, and inherent conflict between the tobacco industry's interests and public health policy interests. Tackling the NCD epidemic through the full implementation of the FCTC is both cost-effective and feasible. And it is the responsibility of governments to protect the public health interests of the population, and its policies should reflect this. Thank you.
Thank you very much, Ms. Chen. Appreciate that very comprehensive presentation. I think that presentation really went into a lot, outlining the challenges with tobacco consumption in terms of impact on life. And then, of course, looking at different aspects of the bill and providing some sort of benchmark standards and practices, even globally, to support those clauses. All right, I'm going to ask you to just, I want to be able to see, can you bring the
I'll stop sharing, right.
Right, let me see who is on. All right. Right, so I think that presentation is food for thought. Now, was the presentation circulated to all the members? Do you know?
I don't think so, but I can certainly make it available. I'll email it now.
Please,
I don't have it, Chairman.
I will have it sent.
Okay, please. So we'll send it to me. I can get it to the parliamentary team, and they can circulate it. Okay. All right. So the floor is open to members for any questions or brief comments. I think there's a lot there to chew on and to digest. I know she was going a little fast, I think, because of the restrictions of time. I want to begin, therefore, with our Senator Longmore, who has her hand up. Senator Longmore, you want to go? Unmute your mic, please.
Sorry. Thank you. Good morning, all. Thank you, Chair. Thank you, Ms. Chen and the NCD, National Council on Drug Abuse, the Heart Foundation, for your very significant presentation. And I won't underscore, I think you were very, very effective in relating the very significant health risks that nicotine and cigarette smoking poses to the general population. But just two key points, because I know a lot of persons want to contribute at this point. Two key points that I want to just highlight. I'm very glad that you brought some focus on e-cigarettes and the very significant danger that it can be to especially the teens, and because what we're seeing and what we have seen is that there is significant increased use, and that is the population that is almost subconsciously targeted because it looks cool and it's the new way and it's the tech-driven way. But it is significantly deleterious to a teenager's health, and it significantly predisposes to developing further addictions later on. And one of my concerns is that there is no requirement for the warning labels and the PR focus on e-cigarettes, and especially amongst the teen population and young adult population. So I'm very glad that you brought that up, and I think that is something for the committee to definitely consider in terms of focused PR campaign around e-cigarettes and the danger of that it poses, and particularly those very significant graphic warnings that we use for the packaged traditional cigarettes, and probably expanding that towards e-cigarette use. The other quick thing that I wanted to just relate to is part 5, where you indicated around the tobacco-free environment, and clauses 12.1 and 12.3 part 3C, where the environment, the distance requirement differs. Now, smoke don't know the distance. And the person who is the lungs that is taken in the smoke don't know the difference between 5 meters and 10 meters. So I think that we should personally, and I think this is a position that the JPA, the Jamaica Psychiatric Association, also holds, that we go with the greater distance of 10 meters and err on the side of caution. I am myself, I'm not too sure whether 10 meters is even adequate, but I was guided that this was based on findings that internationally, this is what is, I'm so sorry. Sorry. Internationally, this is what obtains. So I think that that incongruence between 5 and 10 meters makes little health sense for me. And I would suggest that we go with 10 meters at the minimum for both circumstances. Thank you, Chair.
Thank you very much for that. I'm going to ask Mr. Edwards to comment on, I want to reiterate or re-emphasize the whole concerns around e-cigarettes. I've had my own issues just observing the sort of fad, if you will, that has caught on among a fair segment of the population, but I'm particularly concerned about the young people, and as young as in the schools, where this device or these devices are easily concealed because they come in different, should I say, shapes and forms. You can't smell it as you would the tobacco, and sometimes even smokeless and or fumeless, if you will. And so it's easily concealed. It looks like an object that is used in the classroom, so you wouldn't know that it's a cigarette. And indeed, there's at least one case where there was an advertisement that was literally across from one of the prominent corporate area high schools, promoting the sale of the device. So every time a child enters that gate or exits that gate, they see this big ad literally across the road from the institution. And I think we have a responsibility as a committee and as government to do something about that. And so I really think it's important. The warning labels, very important. And the penalties for persons who can disguise and advance these devices. Oftentimes, we don't know what is in these devices, because one of the controversies that I see coming, or the discussions out of the developed world where these things are created or invented, is what actually goes into these devices, because there is evidence emerging that not all e-cigarettes with nicotine are the same. Not that we support any of it, but some can be quite more dangerous than others because of the chemical makeup. So as you know, you can put literally anything in them. And in fact, some have had to be withdrawn from the markets because it's now showing out in practical habits that there are deleterious to your health. And I just think it's an area that nothing has been done or said. And it's very important that this piece of legislation captures the risk and articulates a position that protects particularly our young people, but at the very minimum too provides information to consumers so that they are fully aware as to what choices they make. And hopefully they are discouraged from making those choices in keeping with the irreconcilable difference between tobacco consumption and the population. Mr. Edwards, I wonder if you could just comment from the legislation perspective as to what exactly, how is e-cigarettes handled in the legislation, and let us as committee members decide whether or not enough is being done on that front.
Thank you, Minister. So we go to the definitions, and the definitions in the bills, starting with clause 2, speak to the fact that the devices and the products we are referring to include nicotine devices, nicotine products, and these are defined to mean, if you look at page 5 of the bill, nicotine device means a device manufactured for consuming a nicotine product by producing an aerosol or vapor for inhalation, and includes any item or part made for use with the device, including a tank, capsule, pod. I think we saw Ms. Chen giving us illustrations of the types of devices. So the bill does contemplate both tobacco devices and nicotine devices, and the restrictions or the controls in relation to warnings and information to be put on packages. If we look at clause 20 on page 23 of the bill, it speaks to the fact that there is required to be a graphic health warning in the case of every tobacco product or nicotine product. Any such supplier of any such product is required to display the graphic health warning. So strictly speaking, the warning requirements also apply to e-cigarettes. Clause 20 in particular is relevant there, Chair.
So what about the case? Sorry again, but what about the case of I've identified where you actually are promoting the sale or an establishment is located across from an institution? Is the law silent on that, or the bill proposed law?
No, it is not silent on that. I am going to refer to.
I believe that's in clause 19.
Yes, that's right. The prohibition on sale in certain places. So if we look at page 22 of the bill requires that or prohibits any person from selling, offering for sale a tobacco product or relevant product, which will include the e-cigarette, in any of the following places. So the list of places in clause 19 are healthcare facilities, sports, athletic, or other similar facilities. C, public places. D, educational facilities. E, childcare facilities. And there's an opening for the minister to declare other places in this list. So there is a prohibition in terms of the sale or offering for sale within such distance as may be prescribed. So this is to be determined. This is to be determined when the law is settled what the prescribed distance would be. So the discussion that has been initiated and Senator Longmore has raised certain matters in relation to distance. It will be useful to hear the committee's recommendations.
Chairman. Oh, I have some hands up here.
Oh, this is just a little point on what he's talking about. Because
likewise,
you asked a question
okay.
that the advertising, this only speaks to sale, not the advertising. The the chairman mentioned where you have a billboard across from a prominent high school. Does provisions in this bill prevent that from happening? And what you have just explained only speaks to selling of tobacco cigarettes at those places.
Yes, so if we look, thank you, member guys. So if we look to clause 24 of the bill, well, the truth is there is a ban on advertising and promotion of tobacco products. Right. So it's the issue really is that the first principle in 24.1 is that advertising and promotion of tobacco products or relevant products is prohibited. That's the first principle.
Maybe you would want an insertion, Mr. Edwards, in clause 24 to include what the minister was specifically speaking of. But we can look at that at a later time. But that's where I think it would fit.
Yeah, I worry, to be honest with you, and I thank the members for assisting me in this concern raised. I just worry about an institution, a place of learning for our children, where directly across the street, there is a business that is advertised as a business, and included in that is the fact that they are a retailer of e-cigarettes. It's just too much temptation for a young developing mind, particularly with all this sort of fad and the sort of buzz around this new invention, if you will. And I've seen where it has caused challenges. I'm a parent, so I understand and appreciate the concern. I've spoken to parents who have brought it to my attention as Minister of Health. I've gotten emails, I've gotten calls on it. I've had parents expressing significant concern that they have found these devices in their school bags, and it has and you know it's not inexpensive, but it appears that the desire to try it, and those who promote it, even sometimes peers, you know, the peer pressure.
Isn't it prohibited? What you're talking about is prohibited by Section 24 of the bill.
But I want to be clear. That's what I'm saying.
Chair.
That is in fact.
And thanks Senator Golden Campbell for and the other members for putting the focus on this issue, because this, in fact, Chair and members, is one of the significant reform areas. So the problem we're dealing with now is because of where the law is now. The law hasn't reached to where the bill wants to go. Where the bill wants to go, we'll see what you, Chair, are concerned about and other members in terms of advertising in the face virtually of young people and their educational institutions being prohibited. So section, and that is why this provision is relatively long, because it not just states a basic prohibition, but it elaborates further as to what is contemplated by prohibiting advertising and promotion, the placing of advertising products at events, the display of products, the dissemination of information, promotional information, and then there are exceptions. It may be useful for us to look at what are the exceptions where tobacco products or relevant products can be referred to. Not in the context.
May I just come in?
All right, hold on, guys. I think this is useful, but we're gonna try to maintain the order. I'm gonna ask Senator Longmore, since she raised the issue first, to just quickly conclude with her comment, and then we go to Member Gale, then Malahoo Fort, then Member Guy, and then Campbell.
Chairman, I have a little difficulty. I have to run into a meeting with the PM, but I do want to weigh in before I go. So
go, right. please, AG, go ahead, please.
Right. Thank you so much. Chairman, some of the things that the bill is seeking to do in the interest of public health also touch on areas that are regulated in other portfolios. I believe that we will have to make some determination about the overriding public policy from a public health standpoint and look at the extent to which the government will have to choose that they must override other considerations. So the clarity with which we state the objectives and the data that we are relying on is going to be critical on the policy side of the bill to justify the provisions and the stance being taken. Very important. Let me just thank Ms. Chen for a very comprehensive and thought-provocative presentation. It's not easy work that we have to do here, but I mean, more and more as the information, the evidence, the data is presented, it becomes clearer about the choices that government will have to make. I just want to say that I was recently asked to participate, which I'm still considering, as to the obligations of government in regulating matters that touch on the health of the people. And in fact, whether the government has a duty which can be litigated to protect the health of its individuals and to guarantee certain health standards. It's an issue that is raging in the international community at this time, and something that we will have to consider, or which this committee is provided an opportunity to consider. Chairman, because I have to step out, may I just crave your indulgence to ask that the correction be noted for paragraph 7. I will come back over because this matter is really interesting for me and for the guidance that my team at the AGC will have to provide when we come to reviewing the bill. Mr. Edwards, so I just crave your indulgence.
Okay, Madam AG, and I think we will welcome your elaboration on the point you raised, because I think members would like to benefit from better clarity on it and maybe give their own input. But go ahead, I understand your urgency.
Yes.
All right.
So it's not cooperation, it's different pieces of legislation.
That's what I thought.
Yes. Thank you so much, Chairman. Please excuse me briefly. I will come back over to the meeting. I just have to.
That's fine. All right. So can we go back?
But the SG will hold forth.
No. Okay. Thank you. Senator Longmore.
Thank you, Chair. I just want, whilst we engage in this discussion, within the definitions, electronic non-nicotine delivery system indicates means of an electronically operated product designed to deliver an aerosol to users by heating solution substances that do not contain nicotine and any solutions intended for use with or in the product. This is of concern because what we are specifically putting prohibitions to is the nicotine and the tobacco and nicotine containing products. What is specifically used at times in the vaping solutions that are targeting especially young persons that carry significant risk do not necessarily contain nicotine. Now, I'm not sure if this obtains within this piece of legislature, but it specifically, and that is kind of like the loophole that exists, where because there is an exclusion of the nicotine, it may apply or on other legislation, or whether we need to expand this. Of course, sets the precedence also for cannabis legislation too. So I want us to just remember that we have that exclusion in terms of electronic non-nicotine delivery system for us to consider in our discussions. Thank you, Chair.
So the point you're raising is that one could find a loophole because the device may achieve the same addictive purpose, but is not regulated because nicotine component is not.
And not just addiction, but health concerns, just as this is Ms. Chen, yes, Ms. Chen, with the cardiovascular risk, the cancer causing risk, etc.
Mr. Edwards, wouldn't the device and how it is used and described be captured in the law? Clarify that for us. I mean, it is. Go ahead.
Here, if you may, I just want to find the specific provisions that would help the members. So if we could continue with the other matters, and then I will get to the specific provisions to address Senator Longmore's point.
Because I don't think smoking is defined as just the consumption of nicotine, but clarify that for us so that we can capture that or adjust this there. Member Gale, you're next.
Thank you, Chair. Good morning, everyone. I want to go back to Ms. Chen's presentation, and I think it was a well informative presentation, and I want to commend you and your team for it. I somehow got a slightly different version in my package. And I want to refer to a reference to tobacco tax, where HFJ suggests that some of the funds collected from taxes or fines should be used in control prevention programs. Now, I think this is critical, and I would want you, if you can briefly explain to us from a policy recommendation perspective, what are some of those ideal prevention programs that you're prescribing?
Yes, certainly. Well, the National Council of Drug Abuse, who will be speaking shortly, are very well placed to carry out these prevention programs. And in fact, they do carry some out, funds permitting. Some of it would be public education, but there's a more basic thing. For example, in the Ministry of Health, there are calls, WHO recommendation that there is somebody specifically assigned to tobacco control because it's such a broad area. And unfortunately, we have not been able to achieve that. Everybody has competing, priorities in the ministry. So we would like to see somebody dedicated to tobacco control. The funds could be run through the National Council on Drug Abuse, and they have some excellent programs, which Mr. Tucker can tell you about himself, in schools, and they do monitoring of things like they monitor events to make sure that there's no breaches in relation to youth being, offered cigarettes and various other things. So I think it's education, but having somebody in the ministry specifically assigned to tobacco control. But I think the National Council on Drug Abuse will be well placed to carry out these programs.
Thank you. Thank you for that. Thank you, Chair.
And the truth is, we do have programs. Well, I think the issue should really be how do we amplify or expand those programs. I mean, there are a number of programs, whether through the Council on Drug Abuse, through the NHF or otherwise, that are there. But point well taken, and I agree with you that the public education component is important. All right, thank you, Member Gale. Can we go to now Member Guy and then Member Campbell?
Thank you very much, Chairman. Just two comments on Heart Foundation's presentation. First of all, very comprehensive. Thank you very much, Ms. Jen. Just two questions. You said that the cigarette smoking was second to hypertension in terms of worldwide mortality. Is it just cigarette smoking, or is it complications? Is it the primary or the secondary cause? That's one. Two, the GYTS, you said it was kids in school. What ages are you referring to? Because school would also refer to university. So I just want to know if it is just primary or secondary schools. And the third comment is the third commentary I have was based on a comment by you that the 80% is the provisions of, and I'm quoting the provisions of the FCTC, and you're happy that we are following the worldwide trend. Yes, the FCTC says upwards of 30%, if I'm not mistaken, in terms of the packaging size. So, it created a little discord in my mind when you mentioned that it accords with FCTC. Granted, 80% is about 30%, but the worldwide trend, yes, I agree with that. But the other part of it, just for clarity. And finally, Mr. Edwards, I know you're combing through the presentation for non-nicotine device, but I've not seen anything in reference to it. And I agree with Senator Longmore that it's not just the effect of it, but the effect on the lung. And not just the addictive effect, but the effect on the lung and the body as a consequence of inhaling all of these, as was explained by Mrs. Chen in her presentation. But there's nothing in the legislation that I see so far in the bill that speaks to it except defining it. And there seems to be a loophole here.
Okay.
Thank you.
Any comments on, well, there's one question at least I heard it there. The others are comments, I think. Ms. Chen, you want to respond to any?
Yeah, sure. Mr. Tucker is well placed to speak about the GYTS study shortly, but I believe it's 13 to 15-year-olds, Member Guy. Yes, with the smoking and hypertension, my understanding is that smoking will be the primary cause of the mortality, which would then lead to other things, like lung cancer and heart disease and so on. As regards the graphic health warnings, the WHO stipulate a minimum, but ever since the FCTC was first written, there have been many more studies have been done on various articles within it. And the most recent studies are showing that the graphical warnings up to 85% are much more effective. So maybe if the FCTC was written now, they would have started at a higher bar, because since then data has become available. So you know, the 80% is something that is ideal now based on current evidence.
Okay, thank you. All right, Senator Golden Campbell.
Thank you, Chair. Just want to take a look at section 20, which section 19, which we were discussing earlier in relation to the exposure to tobacco sales. We then went on to 24, which I think is what governs advertising. But in 19, where we talk about the sale, if Mr. Edwards could just clarify, it came up in the thought came to me in the course of the discussion earlier. At 19(1)(c), public places is defined in the bill as any structure, facility, place of assembly, or other place available to be used collectively by the public, including a government office space or a building of any type, regardless of the ownership of or right of access to any such place, office space, or building. And so my question is, I'm not recalling whether that is also, well, no, advertising is completely prohibited. The use of public place in section 19, doesn't that essentially mean then that there's no person who can sell or offer tobacco products at all?
Through the chair to Senator Campbell, in a public place.
Yeah, but if a public place is any place.
Well, any place that's available to be used by the public, not just any place.
Available to you. So is a pharmacy available to be used by the public? Is an ice cream shop available to be used by the public?
No, those are private facilities. Those are private facilities.
So, Mr. Edwards, can you give us the examples of then the public facilities?
All right, so public facilities would be, as we mentioned, a government office that's available for the public. A facility such as for instance, a community center, a facility such as an airport, normally, a transport venue, transport facility would be treated as a public facility. It's not just a place where the public can go with permission, because there are many privately owned places where the public goes with permission, and people may think that they're public places, but they're really not. They're private places that admit members of the public. But we're speaking about public facilities, many of which will be owned by the government. So a park facility that is owned by the government or is owned by a private entity, but made available for use of the public, would be treated as a public facility.
The definition that you have in the definition that you have in the bill in section 2 says any of these 4 types of places: structure, facility, place of assembly, or other place. And it doesn't qualify in my mind what you have just said. It says available to be used collectively by the public, and I would argue that any place of commerce is available to be used collectively by the public. And I don't see how that definition excludes anybody. I'm guided, but I'm having a challenge with that definition, because it seems to me that the bill is prohibiting sale everywhere, which I don't know if that's what we intended to do. The matter arose in the course of the discussions earlier based on minister's concerns, and I was looking at the provision, and I noted that I had made a note in my review of the bill of that issue. So I really want to just flag it now. I'm not necessarily saying we need to deal with it now, but I just want to flag it for the purpose.
But then what we, so, sorry, Senator Golden Campbell. So what we'd end up doing is equating a facility such as, say, an Emancipation Park or a community park with a private supermarket or a pharmacy. And the fact that those places admit members of the public does not make them public places.
I completely agree with you. I completely agree with you. But my argument is that your definition makes them public places. I agree that they're not. But I think this definition of public place certainly captures them.
So couldn't it be a public place where the public goes? I mean, what is that? Is that the kind of clarity that you're seeking, Senator Golden Campbell?
No, Minister, because I think I understand what I understand Section 19 to do is to prohibit sale in proximity to certain critical places. That's what I understand the policy to be trying to effect. So I get educational facilities. You don't want it being sold near children. Sports or athletic facilities, where healthcare services are being provided. I get the public policy reasons behind those. But when you say public places, and the definition of public places, in my view, captures everybody, then I think the provision may be going outside of its intent or outside of the scope of the policy. Yes. And so for me, I think the remedy is probably just tightening up the definition of public places. I can't suggest to you know, Mr. Edwards, a remedy, the actual words that I would want to see. I'd have to think about that a little bit more, but I suspect you would get there a lot faster than I would. So I just want to flag it for your attention. And we can follow up with it at another time, Minister. I wouldn't delay us today on that.
Okay. Mr. Edwards, make note of that, and we'll come back to that later on, okay?
Yes, thank you, Chair. If I may, very briefly, Chair and members, the whole concept of the public place was really meant to cover places that we see as community centers. When I say, I don't mean community center in the local community center. Centers of activity, such as courthouses, post offices, parks, those kind of public facilities, not just places where members of the public frequent, because members of the public may frequent restaurants, bars, hotels, supermarkets. Right. But we're talking about places that have some kind of local or national standing, so that members of the public see those as places that represent their facilities that they can go to for whether it be a courthouse for justice purposes, whether it be a park for recreational purposes, whether it be a kind of health facility or a beach or something like that. So just like how you have a difference between a public beach and a private beach, and members of the public may frequent the private beach, but that doesn't make it a public place. Mm-hmm. So we may have to tighten up the language in that regard.
Let's get back here.
Minister, if I could,
speaking, just turn off your mic, sorry, please. There are a couple of mics on. I see Dr. Agrians. Welcome. Your mic is on. And
yes, I just turned it on. I've been muted for all this time, but I am told that you may want to ask a question or two, so I'm available.
Okay, thank you very much and welcome. You're making a point, Senator Campbell. You're finishing up a point.
Well, I'm not saying further on that, point, Minister, but I did want to ask one last question before I gave up my position, because I know that the lines may be long today. And I'm asking this slightly from a devil's advocate point, but also I had some recent conversations with ordinary citizens about this issue. And so from a policy point of view or a law point of view, why we're going as far as we're going in this bill? What prohibits us from banning cigarettes in the country completely? And Minister, I'll leave that there. You can address that now or after the presentation, but I'm asking a question that was raised to me earlier this week.
Okay, well, we're gonna have the Heart Foundation to, and maybe Dr. Irons, you came in at the right time, because you can give your opinion on that as someone who's been part of the coalition also. But while you're thinking through that, I wanted to ask a question around the socioeconomic groups and the impact and the argument around, well, tobacco causes cancer or other forms of diseases, but so does excess consumption of sugar, fats, and salts, which we are trying to address. What is the difference? And I know that has come up. I have had discussions with persons and they say, well, you know, if you eat too much sugar, you're going to get something too, or too much salt, you're going to get something. I don't know if Debbie wants to come in, and then Dr. Irons or Dr. Irons first. Maybe we could just bring all of those together and give a response.
Dr. Irons, you're muted.
Yes, I'd like Debbie to address that.
I was hoping you would. No,
I'll speak after you, Debbie.
I think
Sure, Debbie, sorry, Ms. Chen. If I may, allow me to just say good morning to Dr. Irons for obvious reasons.
Good morning, Senator. How are you?
I'm good, thank you.
Good job so far, good job.
Thank you. Please, Ms. Chen, thank you.
No problem. Minister, I think that one of the main things is the addictive nature, and Dr. Irons is well placed to speak about this. But can you imagine you have a product and the nicotine can be calibrated to the extent that you can keep your customers coming back for more? It is the addictive nature of the nicotine, which then, by having the cigarettes regularly due to your addiction, and then all the other harms that come with the other combustibles that are in the cigarette. So that makes it far worse than other products. Other things, you can talk about moderation. You can talk about 6 teaspoons a day of sugar for women and 9 for men. You can talk about 1 teaspoon of sugar a day for salt a day for people who do not have high blood pressure, all told, for example. But there's no safe level of tobacco use, and the nicotine is addictive. Dr. Irons, I don't know if you wanted to.
Yes, but given the current climate, I think if we can just use our imagination, we can see the tobacco in the same way that we now see a virus, meaning that it is an agent of disease. And therefore, we have to decide how we are going to deal with what has been an epidemic of smoking, which has been rampant in the entire world ever since the last World War, when cigarettes were dealt with like an item of currency and as a drug that would pacify the embattled, make them calm in the time of stress, etc., but which, after Dolan Hill studied it properly, was found to be extremely harmful to mankind. And we know, everybody knows, that the act of smoking is a dangerous act that will inevitably lead to death, as many of the principal executives of cigarette companies who have smoked, almost each and every one of them, at least the local ones, have died from some kind of lung disease. And that we don't need to be reminded how dangerous cigarettes are. And it's not just a matter of banning cigarettes, although it might be a good idea, but we live in a society where there is still freedom of choice. But there must definitely be rules that prevent us from hurting each other and spreading this cigarette smoking epidemic, because we have now gotten accustomed to thinking in terms of pandemics and epidemiology and so on. So it should be easier to transfer that knowledge now to what really has been an epidemic, which is smoking.
Okay. All right. So I don't see any other hand up, and we do have another presentation. I think this presentation has really stimulated, if you will, the senses and given us an appreciation for what is at stake. I think there's a lot of research that has gone into it. I want to commend the Heart Foundation, and the presentation was quite clear, and it's going to be circulated to all its members, and we will get back to and use some of the content of the presentation as we finalize the bill to go to Parliament. So I want to thank the Heart Foundation, Debbie and her team, Dr. Anns and others who are on. I do believe that a number of issues that you address are in fact the issues of most concern. The e-cigarettes to me is a big issue, and is one that we have to be very clear on. Some of the language and definition that were raised. And of course, there is undisputed sort of the facts that tobacco does have a deleterious effect. And it is something that we should discourage. Now, the question raised by Senator Golding Campbell is she says she's playing the devil's advocate. I mean, one could say, well, you know, maybe we should ban alcohol also, given that alcohol may actually, or the abuse of alcohol contributes significantly also to death. So it may be a philosophical question and one that is worthy of some conversation going into the future. But the reality of it is that we have tobacco here, or smoking as a practice. It is a legal product, but it's a product that comes with significant side effects, and perhaps even more so than most other products. And therefore, the information and the caution is absolutely important in terms of those who choose to use it. So I think that should be sufficient to guide some of the conversations that we will have and ultimately the debate in Parliament. But thanks a lot to the team from the Heart Foundation. And can we now go to the...
Chair?
Yes.
If I may, just to close off, there was an issue relating to ends. If I could just point members to some other provisions that may help. And these would be section 15 of the bill, section 15.2, which prohibits the supply of ends to children. It is very specific in relation to children. That's section clause 15.2 on page 20. And then there's also clause 20, subsection 4, which is dealing with the packaging. And that is speaking to what would be required in relation to ends and the display of no smoking signs. We take the point that there may be some further tidying up that needs to be done, but I just wanted to point out that the concept of ends doesn't just end with the definition. It appears in relation to the provisions relating to protection of children and in the provisions relating to packaging.
Okay.
Thank you,
Thank you very much. All right. Okay. Thank you very much. Can we now move on to the NCBA?
Yes, Minister. Are you seeing the screen?
I'm seeing the screen. Yes, but no, I'm not seeing the presentation on the screen.
Okay. Is it there? Is it there now, Minister?
Very much there now, and in the way it should have been earlier. Thank you very much. Go ahead, Mr.
Okay. Thank you for the opportunity to present to this group. Okay, so this presentation will cover, it's just loading now. Okay, great. So, I don't know, today is not a good day for us at all. Hold on.
Was the presentation circulated?
It was circulated, Minister, yes. Okay.
Well, you have it now. You can go.
Okay, so first of all, we're going to do background on NCBA. We're going to look at tobacco and health. We're going to look at international and local context. We're going to look at youth and tobacco use. We're going to look at NCBA's treatment and prevention response. We're going to look at demand and demand reduction priorities and benefits of the 2021 tobacco regulation. So our background and interest in the Tobacco Control Act. So what makes our input valuable, ladies and gentlemen? We have had 37 years of providing Jamaicans with quality drug prevention and treatment services. And of course, all of these services and the prevention programs are underpinned by relevant research. And of course, our mission is to make Jamaica a better place to live through the reduction of illicit and illicit substance misuse. So we are advocating for the rights of children and adults to be protected from tobacco in all its forms. We want to give the facts and provide some evidence about tobacco and its effects on the human body. We want to prevent youth use of tobacco in order to improve health outcomes. We want to provide effective tobacco cessation interventions for individuals, families, and workplaces. So when we look at tobacco and health, we see where smokers have a greater risk of developing and dying from severe COVID-19 complications. There was a significant discussion about e-cigarettes. We see nicotine in e-cigarettes is a highly addictive drug that can damage children's brains. Non-smokers exposed to secondhand smoke are at risk of developing lung cancer. And we see on average, lifelong tobacco smokers lose at least 10 years of their lifespan. And of course, there's also a risk of developing diabetes for smokers. So we know that over 80% of the world's 1.3 billion tobacco users live in low and middle income countries, and Debbie did go into that fact. We know nicotine contains tobacco and is highly addictive. Containing tobacco is highly addictive. And of course, we know that there are significant risk factors for a number of cardiovascular diseases and respiratory diseases. And we also know as a fact that 20 different types of cancers result as a result from tobacco use. Tobacco kills up to half of the users. And we see where more than 8 million people that use tobacco each year, 7 million of those, 7 million deaths each year. 7 million of those deaths are a result of direct tobacco use. Well, about 1.2 million are a result of non-smokers being exposed to secondhand smoke. As was said, and we all discussed, no form of tobacco use is safe. So in terms of international context, in Western countries, smoking is more prevalent among populations with mental health problems, with alcohol and drug problems, and among criminals and among the homeless. Now, the smokers worldwide has increased from 721 million in 1980 to 967 million in 2012. And tobacco consumption has leveled off or declined in developing countries while it continues to rise in developed countries. As is expected, smoking is 5 times more prevalent among men than women. But you have to consider the gap across different countries. And as the group gets younger, this gap gets smaller. And in 2002, about 20% of young teens aged 13 to 15 smoke worldwide. And we know that they will continue smoking for 15, 20 years of their life because of how addictive nicotine is. So when we look at the prevalence, the local context, this is coming out of the 2016-2017 National Household Survey, 11% of the population aged 12 to 65 years reported current use of cigarettes. Males' use was significantly higher at 17% as compared to females at 5%. Prevalence of current smoking was high among the 35 to 44 age group when people are at their highest productivity. High prevalence of current smoking was also found among the unemployed, skilled workers and those with secondary level education, and those from households with monthly income of $50,000 or less. And of course, 62% of those who were current smokers reported chronic use, that was daily use. So almost a third of the population, 30%, reported use of cigarettes at some point in their lifetime. And this was up from 22% when the National Household Survey was done in 2001. The age of initiation of use was 16 years among males and 18 years among females. And the parish of St. Anne featured as having the highest prevalence at 17.5%, as opposed to Hanover, who had the lowest prevalence. Current use has 6.9%. So in terms of local context, risk perception, 55% of the people who were interviewed, there was a moderate to high risk associated with smoking tobacco in any form, whether cigarettes, e-cigarettes, hookah pipes, whether it was done frequently or infrequently. 30% were uncertain though. They weren't certain about what risk they faced when they used these products. So when we look at the Global Youth Tobacco Survey 2006 and 2010, the youth population there, 32% of the males were current smokers, while 40% of the females were current smokers. We saw where tobacco companies were specifically targeting youngsters with their marketing initiatives. We also saw where advertising that were offering scholarships and other promotion activities could and did influence adolescents' desire to smoke. And of course, the use of strategic youth-oriented hashtags and flavored e-cigarettes seek to normalize smoking as a habit that will ensure a future market for their product. And this is a significant problem, and a lot of discussion was taking place about e-cigarettes. And of course, we see where children who started to smoke before the age 10 increased from 18.7% in 2006 to 20% in 2010. So the 2017 survey showed that 15.6% of the students 13 to 15 years use any tobacco product, while 14.4% currently smoke tobacco. So 11.7% of those youngsters use e-cigarettes, 32.1% were exposed to tobacco smoke at home. So 48.2% were exposed to tobacco smoke inside enclosed public spaces, and 63.5% were not prevented from buying cigarettes because of their age. We saw 49.7% of the youngsters had noticed anti-tobacco messages in the media. 32.2% noticed tobacco advertisements or promotions when visiting points of sale, and 16.8% had something with a tobacco brand logo on it. So what has been our response in terms of the prevention and treatment of tobacco? We have done screening, we do brief interventions, we do long-term treatment for those chronic users that need long-term care, we do referrals where necessary, and we do relapse prevention. So, ladies and gentlemen, we utilize evidence-based approaches to implement drug demand reduction initiatives. And then we also tailor it to the particular groups or individuals that we are targeting and we want to help. So we look at their risk profile and socio-demographic attributes. Unfortunately, uptake for tobacco smoking cessation services has been low, between 2 to 9% of our clients seen for problematic drug use between 2016 and 2020. And most of the clients will tell us that is because of the prohibitive cost of smoking cessation products, why they aren't able to participate in these programs. And it's internationally accepted that prevention is cheaper and more effective than efforts to cure problematic drug use, including tobacco addiction. So what are demand reduction priorities? One, capacity building in the primary healthcare system by training primary health professionals to screen and provide brief interventions. We have seen, Minister and members, that this is very, very effective, and the expert approach screening, brief intervention, referral to treatment should be rolled out as a matter of policy in every health region among all categories of healthcare workers, so that we can have swift and impactful interventions. We wanted updated vend list in terms of the National Health Fund's vend list, because then we want inclusion of non-nicotine tobacco cessation aids to be included in order to increase treatment and health outcomes. And these medications would assist clients to manage their cravings and mood swings. Where prevention is concerned, adequate funding for the promotion, implementation and management of robust, universal and selective prevention programs is required. More funding, and this is a cry from everybody, Minister and members, adequate funding for the promotion, implementation and management of tobacco cessation programs at community level. And of course, coming out of the WHO model, they do tell us that we need a dedicated quit line to assist people who want to quit smoking. What were the benefits of the full adoption of the 2020 regulations? There'll be an expansion of prohibitions to include use of electronic nicotine delivery systems, such as e-cigarettes, and that has been discussed, and of course, I can see the members agree with that requirement. Provisions to prevent sales to minors, and of course, banning of advertising and promotion and sponsorship from the tobacco companies. Of course, support for reducing dependence would also result, and there'd be a fixed penalty regime and graduated penalties. So we're depending on you to adopt the full regulations. We want to help our youth, and you all have the power to give them a chance for a great future. We want to help Jamaica to be a place to live, work, and breathe easy. And of course, if you know somebody who needs help to quit, please contact us, and that's our helpline there, 876-564-4375. And this is contact information. We're located 1350 Malines Road, and that's my telephone contact information. Thank you very much, ladies and gentlemen.
Okay, thank you very much, Mr. Tucker. If you want to just, let me see the hands up, please. All right, thank you, members. And that was the presentation from the NCBA, which, by the way, is a unit of the Ministry of Health and Wellness with the responsibilities as outlined earlier in the presentation. And the evidence is clear that there is a relationship between premature illness and death and tobacco consumption, but very importantly, is a re-emphasizing of the addictive nature and the temptation to our younger population, which we have a responsibility, I think, to protect. And the e-cigarettes came up also there. So I want to ask first member with his hand up, Member Guy, to comment on any questions.
Thank you, Chairman. Thank you, Chairman. Mr. Tucker, what's the benefit of having in the first part of the presentation, the statement that 80% of the 1.3 billion cigarette smokers live in middle and low income countries?
Just to say that it shows that the cigarette companies have targeted, well, I did make a statement about the use of tobacco being reduced or leveling off in developed countries. In developing countries, because of the addictive nature of tobacco, significant portion of people's earnings go towards cigarettes instead of supporting positive things like family education, things like health, other things, and therefore it is a warning sign that we have to do something significantly because Jamaica is a developing country and there are many others like us. So we have to ensure that people are protected. First of all, they get treatment if they need it, and that the earnings is redirected into productive and meaningful uses.
I ask that because it is just a reflection of what happens in the world. About 83% of persons in the world are living in low and middle income countries. So the slide doesn't really indicate the point that you want to make. So I think you probably should have a little clearer definition, a clear indication of that. And I think the presentation by the Heart Foundation spoke better to what I think you're trying to tell us. Than saying that 80% of the 1.3 billion live in those countries. Because it's just a mirror of what happens in the world. 83% of the persons in the world live in lower to middle income countries. So proportionately, you'll find that, if you go by that 80% of those who smoke will be in the lower to middle income countries. But that's the point you're trying to make. And I think it will be better expressed if, as was done by the Heart Foundation, in giving us a clearer picture of the socioeconomic groupings where cigarette smoking impacts and its effect on their earning and their ability to contribute to other areas of their life and development. Just making that point.
One thing is, member, thank you so much.
Sir, Mr. Chairman?
You're muted, Chairman. Chairman, you're muted.
Yeah. Okay, now I was saying I don't think it does injury to the point. But I note it. I wanted to ask a question, and then I know that Dr. Irons wants to come in. On that point of the lower to middle income, there is an argument that has been advanced that the tobacco companies have deliberately extended their focus to lower income, not just countries now, but communities, through a kind of marketing outreach type effort that gets that population more sort of buying into tobacco consumption, personal selling, that kind of thing. I wondered if Mr. Tucker can comment on that, because that may be a more qualitative assessment, if you will, of why those communities in those countries tend to consume more tobacco.
Well, thank you for that question, Minister. The fact is that the tobacco companies are very, very skillful in terms of marketing outreach, and what we'll all appreciate that a community that doesn't have a lot of resources, if you go in a community like that and offer significant handouts, offer prizes, offer awards, offer whatever, the people present, they'll be more inclined to want or need it, and also be aligned with the tobacco company that is really targeting them. So they have done that very skillfully. If many of you will remember, it may have been quite a few years back, but they went to the extent of actually offering a very attractive motor vehicle. I think about a Lancer Evolution. I think that was very attractive to young people at that point in time, as one of the prizes that they could win for entering a competition put on by tobacco companies. And many young people use cigarettes to get an opportunity to try to win a prize like that. So it's very skillful marketing, and it really sort of looks at the need, and it sort of preys on the need of the people in those communities because they don't have resources, and resources are offered, and prizes and giveaways are offered.
I think if I may, and I'm sorry to delay the comment of Dr. Ans. I think, well, hopefully there is going to be other presentations that may zero in on that point, because I think it's an important area to examine. There is a sort of obligation, I think, on our part as legislators, that the information around tobacco and its dangers is not just transmitted in a way and a format that only those who may be more exposed, if you will, or may pay keener attention, if you will appreciate and respond to, but it goes across the socioeconomic boundaries. Otherwise, what you would be doing is leaving one segment of the population more exposed and, frankly speaking, manipulated, if you will, with information, and then the ill effects would flow from there if we accept that the science of tobacco consumption clearly leads to a particular end result. And I would want to see what those activities are and how we can structure the legislation to provide for better protection to those individuals in those communities. Dr. Ans, you want to comment?
Well, quite simply put, Minister, I first of all want to congratulate those who have prepared their presentations. Much diligence is in evidence, but we have to remember that the cigarette manufacturers are twice as diligent as we are in preparing their strategies and so on. And I think that we've been avoiding using the word predatory in terms of how the manufacturers have gone about moving from one underdeveloped state to the next. And if one were to look at the continent of Africa, for example, one would see that there is a strategy almost to recolonize the continent, this time with cigarettes. And I think we have to be very careful that when we look at it, we're not behaving as anti-tobacco, but certainly behaving in such a way as to exert the kind of control that responsible people have had. Because what is really happening is that the first world is moving away from cigarettes, and the manufacturers are simply saying, well, okay, we're losing the fight here, but let us be more diligent and stronger elsewhere. And it's unfortunate that the new subjects for their assault just do not have the resources and are easily manipulated. When you see something as happening one pack at a time, the cigarette companies are thinking in terms of millions of packs, so that the individual consumer is not really seeing the big picture, and we have to help them to see that big picture. And our country, for example, might, because we grow good tobacco here as well, there are many other uses for tobacco apart from smoking, you know, and we should be looking at the alternative uses rather than simply saying, you know, the tobacco is wicked. It's not the tobacco plant that is wicked. It's how it's been used and how it's been titrated in order to maintain an addiction, which is just as dangerous as any addiction anywhere.
So point taken, Dr. Ans. The issue now is, how does the bill capture, if it does, Mr. Edwards, or your team, the predatory practices, if you will, in lower socioeconomic groups that may be unconventional. I mean, you say no advertising, but there is direct selling, for example, where persons are hired, they are walking brands in their shirts and other gadgets, and they go directly to the consumer and they pitch the sales to the sports clubs or to the dance or parties or Where in the legislation can we see the strength of recognition of that type of approach that primarily goes to a space in the society that places them at a disadvantage, if you will?
Okay, Chair. Thank you for that. So we would have to look back at the issue of the definition of advertising and promotion. So if we just take a quick look back at the earlier parts of the bill where we speak of advertising and promotion, and that's a concept in one expression, advertising and promotion. At the very beginning of the bill, the first page, we speak about any form of commercial communication, recommendation, or action with the aim, effect, or likely effect of promoting a product or the use of a product directly or indirectly. And then we speak about promoting, meaning fostering awareness of, creating positive attitude towards the product, towards the manufacturer, for the purpose of selling the product or encouraging the use of the product through various means, including incentives, free distribution, discounts, promotion of brand elements through events and products through public means of communication. So that's the definition. So then we go to section 24, clause 24 of the bill. We speak of the basic ban in subsection 1, but then there's an elaboration in subsection 2 that speaks of the placing of advertising and promotion of products in events or in content, sponsorship content, the display of and promotion of products in this product display at retail points of sale, and the broader issue of engaging or participating in any advertising and promotion as an event organizer at a media event, using celebrities or other participants that may appeal to people, encouraging sponsorship of activities that will. So these things foster a positive attitude and a sense of community involvement and responsibility, which redounds to the ultimate promotion or sale of the product. So these are some of the provisions in the bill that seek to address the matter that you have raised here.
Okay, Dr. Sapphire Longmore. Member Longmore.
Yes.
Chair, if I may, just before Senator Longmore comes in, there's another element tied into the points that were made by yourself, Chair, and Dr. Irons, and this relates to responding to the strategy of industry, of the tobacco industry, by dealing with the labeling requirements. I know the question was raised at the last meeting by Member Guy as to what was the rationale for moving from 60% to 80%. And we had indicated the trend in terms of the WHO and the FCTC guidelines. But what I wanted to point out is that if we look at how countries around the world have moved to relatively large coverage of their packages with these warnings, we will note that a number of countries in the so-called developing world have moved to some of the largest coverage in terms of packaging warnings. So if we look at the fact that they're over 50% and more in terms of the labeling warnings, 114 countries have adopted labeling that is more than 50% coverage. When we look at India, if we're talking about a country that it will represent significant lower socioeconomic population, India, their government has moved to 85% as the warning labeling size. Sri Lanka, 80%. Uruguay, 80%, Nepal, 90%, and several countries on the African continent between 70 to 75%. So in a sense, FCTC member states have used this strategy of increasing the warning size as a pushback to industry. Thank you, Chair.
Thank you. More.
Thank you, Chair. I just thank you again, Mr. Tucker, for your presentation and the NCBA. I have a different interpretation from Dr. Guy's interpretation of that first slide. For me, it is reflective of the propensity towards the pull in those lower socioeconomic groups towards an activity, particularly because of a lack of other activities to engage in. And I implore us to reflect on addiction and behavior change and how we treat with addiction. And one of the critical things is introducing alternative ways of engaging in the lifestyle. So one of the issues is that persons in these lower socioeconomic groups are predisposed to the addiction behavior because simply they have nothing else to do. Boredom will lead to such behavior. It is the same issue that obtains for things like teen pregnancy, etc., etc. And I now relate it back to what Senator Gale probably brought up earlier in terms of taxation and some of the funds that can be had from these tobacco companies and the profits thereof to be channeled into lifestyle changing practices and offering alternatives in these lower socioeconomic groups, not labeled clearly, not a promotion for, but the fact is that if we channel lifestyle changing opportunities and other sports complexes, public and parks, etc., not sponsored, but if the returns from some of these of the industry can be channeled in that way to simply impact on the predisposition for the addictive behavior that would be present in those communities, I think that is a good way to address the situation. So my observation is not that it is reflective of the general world statistic, but I think it is more the predisposition in those socioeconomic groups towards that activity that can be negative to their health.
Which is, I appreciate that intervention, Member Longmore, which is a point I was making when I spoke to the need to assess and determine the bill's relevance to that socioeconomic segment of our population. Yes. Because it at least must be studied and appreciated why it is that that segment is more receptive, ultimately leading to greater health concerns, greater burden not just on self and community, family and community, but burden on the public health infrastructure. Because by its very definition, that segment of the population is far more dependent. And so it is a very important socioeconomic, I should say, imperative, which influences certainly the public health response and the burden on public health within any society. And hence, any bill that will form legislation must be appreciative of those realities and seek to balance or to address those concerns. So, Mr. Edwards and your team, that must be flagged carefully. And I'm looking forward to other presentations. Hopefully this will come up more often, but more and further examined. But it's going to be important for us to give, to accept almost a greater burden for those who are more vulnerable than others to provide information, and who in turn makes the public health response more vulnerable too, because that becomes now a collective burden that we all face. And I think we have a responsibility to respond. So I think that's a very important point. Any other comments on the presentation? I know it's going on now we're going on now for 2 hours, and we had said we try to keep things within well, actually a little over 2 hours. Any other comments? No? All right, I do believe that we had 2 really good presentations. I want to thank the Heart Foundation, Ms. Chen and her team, Dr. Hans and others, and of course, thank Mr. Tucker and his team for 2 very important presentations. I think we were deliberate in having both groups present today as the first presentations, because you set the context, the foundation for other presentations to come based on your sort of universal assessment and data in keeping with the mandate that you have. And so I think this lays the foundation for us to be members that is to be informed, sufficient to be able to probe further as other presentations are made, and of course to facilitate our own understanding of the subject matter and reconcile that with the clauses in the bill. I'm going to ask that we circulate those presentations and that members take some time to refresh themselves around what the substance of the presentation in preparation for others that will come as we go along. All right, so if that's it for them, let me say thanks. And
Minister,
yes,
if I may, yes, if I may, I am not clear whether or not the minutes have already been adopted or accepted, but I'm not satisfied that I might have been clear enough to allow for the amendments of the minutes in relation to the point that I had made that Member Guy had asked a clarification on, and I don't want to belabor, but in looking back at the minutes, I just want to clarify that the statement was made within the context of the guidelines for the implementation of the specific article, and the guidelines are separate from what I had intended to say in relation to the treaty itself. Now, just to make it clear that the guidelines are the consensus documents which the parties through the COP would have signaled their intent to be bound to. And as I said before, the comment in relation to the guidelines would have been separate from any intent regarding the treaty, which includes Article 5.3 and which makes that provision in the treaty mandatory, especially once we have incorporated the same into domestic law. So it is the guidelines that are actually the consensus documents which the parties have signaled their intent to be bound to.
Okay, right. So Ms. Dennis, I'm taking it that your intervention falls under any other business, which is where I was going. In thanking members of the presenters of the 2 groups earlier. But I think we made it clear. I think we clarified. I think if there's any doubt, this set of minutes will note the clarification. You're further expanding on that, and I think we accept it. So
thank you, Minister.
I think it's useful. Okay, thank you. Are there any other business? We are now in any other business segment. Anything else to raise?
Minister, just for clarification, the next meeting will.
That would have been the next. That would be the next topic.
I apologize.
I wanted to raise any other business as it relates to the 2 presentations, if I may. I think the data and the information contained in the 2 presentations are important to become public information. I would really like to see, and I want to thank those who are on who represent media, to see the conversation beyond this committee and the presentations, because it's important that the public, the general public that is kept abreast and informed on what is being discussed. And there's a rich set of data here. So I'm going to urge the 2 groups that presented, but also our own communication mechanism to get some of this data out there, because I think it's useful. All right, if there's no other business, then we go to the date of the next meeting, and I'll ask Member Colin Campbell to come in over.
Chair?
Yes.
If I may, very, very briefly. and there may be other opportunities, but the issue has come up more than once, I believe, of about the question of policy and the fact that the bill seeks to give directions or provision as to how policy should be framed in terms of the ministerial and the broader level of government, the power to direct how public health policy should be framed in the context of tobacco control. And I just thought it would be useful because it is not something that's usually done in legislation, but we do have precedent in other areas. We're not used to seeing it in the health sector, but in the financial sector, in terms of financial governance and framework responsibility requirements, there are very specific directions given to ministers or other officials in relation to the framing of policy. So although it is not something that we are accustomed to seeing, it's not totally without precedent in our legislative structure. So I just wanted to mention that. The committee may have a view on how policy provisions should be included or modified, but I just thought it would be useful to mention that it is not without precedent, but it's not usual to see it necessarily in the health sector. Thank you, Chair.
Thank you very much. Okay, can we go now to Member Campbell, Pauline Campbell? You were suggesting something on the next meeting.
I actually wasn't. I was the question I was asking, Minister. I was trying to ascertain who the next presenters were. Just we had decided that already, but
all right. Can we be advised by the parliamentary? I think we had a list. That don't have it before me here. Who are the next presenters? Hold on.
I see Carrera's chair is being stated by the technical clerk, Ms. Brandon. Carrera's.
Hold on. Carrera's, yes, and the Manufacturers Association, Jamaica. So it will be 3 and 4 would be the Carrera's group and the Jamaica Manufacturers Association. Okay, and the rules will apply accordingly. So we will provide the appropriate notification to them.
Excuse me, Chair. Ms. Brandon is indicating that the committee had agreed to only invite Carreras for the next meeting.
Okay, well, yes. Okay. Is that so? So I was quoting 3 and 4. So you just want to give Carreras the, okay, fine, fair enough.
And Chair,
yeah,
there was a consideration. You recall that we said we would look at these two, just complete the ones by this platform, and that possibly where Carreras is that we should be eyeballing them.
I much prefer to be in the chamber, and
so
as a group, if the member is moving that we return for the next session.
I am so moving, Chairman.
Okay. Let me hear.
That appears a little controversial, Member Guy, but I'm in support of it.
Sorry, Chairman, if I could just speak, not as a member clearly, but as a representative of the technical team, would it be possible to have a hybrid meeting where the members could be present and some of the technical team could be?
I need to be advised on that, because I wonder how you would maintain a uniformity of control and access to some being there and some not. I don't even know if there needs to be any sort of parliamentary approval for that. So I would need to be advised on that, to be totally frank. But let me hear from the other members.
Chair, may I say, in the Senate Standing Orders Committee had deliberated on that, and there's an agreement around that, and we had attempted with the support of the IT team to have conducted such meetings. So maybe we can ask the IT team of Parliament how that can work. But I appreciate the concern of members who are expressing attending sittings still in Parliament, especially the fact that they have not been vaccinated or they may not have been vaccinated as yet.
But the committee, with respect, is not a very large committee. There's appropriate social distancing that's possible. And the Parliament now meets with far more people. And I agree that they all should have been vaccinated by now. I would certainly say that the members would have been, and I believe the public sector workers, like the AG's office, should have been too, I think, as part of the priority group. So I don't think that should be a burden. I just find that it's a lot more effective being in the chamber. Not my only downside is that I have to put on a suit because I don't like it, to be honest with you. But outside of that, I find the sort of, you know, the presence in the chamber and together makes for a more effective meeting. And I am in this unusual circumstance agreeing with member Guy that we probably consider for the next meeting. Can I get some? But I'm willing to go with the majority. Yeah.
Chair?
Yes. Yes, Mr. Edwards.
Yes, thank you, Chair. If I may speak maybe from a hybrid position, the resolution that was carried seems to cover the situation that our Solicitor General, you know, has raised, because from what I'm reading, the resolution speaks to holding virtual meetings, whether wholly virtual or partly virtual and partly physical. So I believe that, you know, the allowance is there for some integrity to be maintained, even if the meeting allows for virtual participation from remote locations and members.
So there were two concerns. One was the allowance based on the resolution, and thanks for the clarity. But the other was the practicality and effectiveness and just the manageability of it to get the best and most efficient outcome. Maybe some of the technical people could stay and come in virtually, but you know, my own view is that it would be best to have the members of the committee be either there or not there. Can I hear from other members whether you support member Gail and Guy in this and myself, frankly speaking, in this circumstance? Member Golden, you are the one who, Golden Campbell, you are the one who had initially wanted the virtual.
I have no objections to going back into the chambers.
You have objections, you say?
I have none.
Oh, you have none, okay.
I understand the technical team's concerns though, and I do support them in that. So to the extent that we can go back and the team can be virtual, and I don't myself know how that works with Parliament, but I'm pretty sure they should be able to figure that out by now. It has been a year of COVID, so.
Right. All right.
Sorry, Chair, if I may, the IT department has indicated a hybrid meeting cannot be facilitated. That's actually in the chat.
Oh. Cannot be facilitated.
Cannot.
Oh, well, there we go. So it's one or the other. So, Madam SG, if you're appropriately social distance or physical distance and sanitized and masks, would you still consider yourself at risk?
Sorry, Chair, I was trying to actually come on camera to speak as well. Doesn't seem to be working. Anyway, my issue is actually a little different. I have asthma and really bad allergy problems. So I am, especially for the last few weeks, I've been coughing a lot and I'm not fit to be out in public. Everybody runs from me thinking I have COVID. So I've been the official
you don't
so I have a different issue.
You don't need to say anymore, right?
But I actually want to say one other thing. The
Okay.
carpet at Parliament, even when I am in fairly good health, once I spend a good hour or so in Parliament with my mask, I start coughing. That carpet in Parliament, and I don't know if there is an air circulation issue. I'm sorry that I am doing this like this, but it's something I've complained about privately. Um, there is an issue there. And I know I'm not the only sufferer as well. Sorry about that. I know I'm not the only sufferer, but there is also that other issue with whether it's a carpet or an air circulation issue at Parliament as well. So I do have that issue. that issue.
Right. As the Minister of Health, can I have a conversation with you off here on that matter and on your and related to your status? And then let me have a conversation with the Parliament to see what is possible. But can I take it that the members of the committee would be willing to attend the next sitting at the Parliament? If there are no objections, I'm going to assume, based on what 4 of the members have said, that we are willing so to do. And I don't see any hand up, so I'm assuming that there are no objections. And then I will do some further inquiries around the SG and maybe to see where we can go from there. Yes.
Might I suggest that having consideration for the matters just outlined by the SG, that one of her deputies could attend physically and be in communication with her virtually as a communication between both of them, if the deputies don't have similar problems as she does.
Right. So you're advancing.
So if I would be allowed to respond, Chair, currently there is no deputy that manages the Constitutional Legislative Affairs Division, and in fact, I'm the only representative from the chambers attending this meeting. But I can be in communication with persons who are physically there.
Right. So this is why I wanted to deal with it after with the permission of members, because there seems to be a few other issues. So let me follow up on that. But for now, as it relates to the members, we will agree that we will convene session in the chambers, and we will ensure that adequate spacing is allowed for the physical distancing, the masks, the sanitizing, and so on. And as it relates to the SG, I will have further discussions to find a solution, if not just with her, but also with the Attorney General, if that's okay. All right. What about the date? Do we have a proposed date? I have not gotten one, but 2 weeks from now, there.
There's a proposal, Chair, from the committee clerk of the 26th of May at 2 p.m.
Right, 26 would be.
It would have been 27, Chairman. 26 we have in the Parliament.
Right. Actually, I may have a difficulty on that day. I may have a difficulty on that day, actually.
All right, what's the proposed date, Chair?
27th of May.
Thursday, the 27th of May.
Yeah, I may have a difficulty on that day.
The Chair, the clerk, Ms. Brandon, it says May 27th is not available for the meeting.
Oh. Chair, is it possible for us to do it the week before that?
No, I can't do the 20th. Sorry.
Can we do it? We may have to do it the week after.
Mm-hmm.
We may have to do it the week after. Is that okay? I mean, which means a fairly long gap, but I would perhaps have to do it virtually if it's going to be on the, well, it can't be the 26th or the 27th. So basically we would have to go an extraordinary, unusual day on Friday, or go the following Wednesday, which would be what, the 2nd?
The 2nd is available, Chair, according to the committee clerk. June 2nd at 2 is available.
What do I have on the 1st of June? Anything? I have nothing on my calendar.
Well,
I'm almost sure I was told that I have something on the 1st of June.
It's not the 1st we're proposing the 2nd.
I can work with the second chairman. I would.
All right, but why don't we put it for the second then? And
Sorry,
second,
Chair, I actually didn't mean that for the meeting.
oh, no, that's fine. That's fine. So
Second is clear for me, Chair.
Okay, great. So if there are no objections, I'm proposing the second at 10 a.m. If that's all right with all, no objections. Okay, great. All right, so I want to thank you again. This was a good session. There's a message here in the box, but that's that. Committee could meet on Wednesday, May 20th. No. Okay, I think that's it. All right. Right. So let us June 2nd at 10. Okay, June 2nd at 10. Yeah.
Chair, I'm sorry to go against the grain. Is it possible to be on the 3rd, the Thursday, instead of the Wednesday? No.
Are we?
The 3rd at 10 is possible for the parliamentary staff. The 3rd at 10 is possible, Chair.
3rd at 10 is everybody comfortable with that?
No, Chair, I can't make it that day. I'm committed.
All right, so we may have to go back to the second member Longmore. Can you?
I'm not sure if I'm able to make it. I'm Wednesday mornings. I have a set lecture that I give, so Wednesday mornings are difficult for me. So I can try to join, but it's I have a group of medical students that I'm committed to.
What time does that end?
11:30. It's from 10:30 to 11:30. So, and that's the only reason why I was able to probably accommodate before this was because those lectures were held up because of the COVID, but we're returning back to the lecture cycle now. So Wednesday mornings are difficult. So.
And remember, Guy, you are.
All my Thursdays are booked out, and I've made allowance for at least the 2nd and the 4th Thursdays to be here. So, that's.
Might I make a suggestion, Chair? If we start at Wednesday at 11 instead of Wednesday at 10, I mean, it would probably take us a few minutes to get through the minutes. And so we would have both our members, Longmore and Guy there with us by the time the presentations would begin.
Sorry, Chair. PAC meets at 10 o'clock on Wednesday, on that Wednesday. PAC meets at 10.
So what time were you suggesting, Chair? Sorry.
2 p.m. The parliamentary staff was suggesting 2 on the 2nd.
PM on Wednesday.
Wednesday the 2nd at 2.
Well, what you have effectively done is affected my constituency day. I probably could make an exception, but I can't. It can't be an ongoing thing. I mean, I could go in the morning and back, but it would certainly affect the day's activities. All right, let's are we okay with 2 p.m. for the next meeting, Wednesday, 2 p.m.?
I can work with that, Chairman.
2nd of
We
June?
don't have a choice though, Chairman. PAC is in the morning.
Yeah, but Tuesday was an option, but we don't want to.
Oh, I'm sorry. Oh,
we don't want sorry, I mean Thursday, but we don't want to member Guy, or for that matter, member Longmore to miss the meeting. So, all right, let's go with the 2 p.m. then on the 2nd of June as the next meeting.
2 p.m. on the 2nd of June, Ms. Thompson.
Right, and careers will be the next up to present. Okay, thank you very much. I think we had a productive meeting, and meeting is adjourned. Moved by.
Don't move, Chairman.
By member Guy. Seconded by member Gail, I think. Thank you very much, and have a good day and weekend.
Thank you.
Keep safe. Bye.